Hello, this is Sydney Mefford, Emily Seiler, and Marie Downey, and we are presenting the McMath case debate, an argument for the removal of McMath's body for mechanical ventilation. The topic and case summary. The overarching topic is the definition of death. There exists a continuum of death as seen below. On one end is the cardiorespiratory death, with the cessation of function of the heart and lungs. The middle holds whole brain death, with the cessation of functions of the whole brain, including the brain stem. On the other end is higher brain death, with cessation of function in the cerebellum and cerebrum. The definition of death is also not purely biological, but rather holds moral, philosophical, and religious aspects as well, thus highlighting an importance of the variety of aspects of death. In brief, McMath, featured here, was a 13-year-old female with sleep apnea seeking a routine surgical intervention at Children's Hospital in Oakland, California on December 9, 2013. The surgery was a tonsillectomy, adenectomy, and soft palate removal, which was made complicated by underlying conditions. 5 hours after waking from the surgery, Jahai went into cardiac arrest, and it took physicians 2.5 hours to restart her heart, starving her brain of oxygen. On December 12th, she was declared brain dead by hospital physicians, a diagnosis which was reaffirmed by 3 physicians independent of the hospital. Jahai's family, on the other hand, disagreed with the diagnosis, citing religious reasons for their refusal. They called for the continued medical treatment of Jahai, convinced that she will wake up. Jahai McMath is dead, and the hospital should remove the ventilator.
It is first most important to argue that Jahai McMath is indeed dead. The clinically accepted definition of death currently in use was determined by the Uniform Determination of Death Act, which defines death to be the cessation of circulatory and respiratory functions, or the irreversible cessation of the function of the entire brain, including the brainstem. 5 physicians, 2 associated with Children's Hospital and 3 unaffiliated, unanimously agreed on several occasions that McMath experienced whole brain death. This indicates that her body would no longer function as an integrated whole and would likely not be able to maintain breathing after the ventilator was removed. Along with this conclusion, all diagnostic and confirmatory tests have confirmed the conclusions that McMath experienced whole brain death and is deceased. These images are the clinical criteria for the determination of death and show the process of which physicians would go through to determine death, and for McMath, this was gone through 5 separate times. Okay. The second argument is that the resources used to mechanically sustain Jahai's body are extraordinary given this case, and therefore the ventilator should be removed. In determining that Jahai McMath is indeed deceased, a critical discussion surrounds the proper care of her body. Jahai was declared brain dead on December 12, 2013. A week passed before the healthcare team decided it was time to discontinue treatment to her body. We know that even more time will pass as the family, courts, and healthcare teams continue to debate. We must ask, is this what constitutes a good death? Is it right to continue forcing air in and out of a human body just to continue the facade that a body is alive as long as it appears alive? As time crawls along, the possibility of a peaceful, respectful disposal of the body directly after death fades. The mechanical ventilation must not only stop for medical and legal reasons, but also to uphold any sort of morality left in the situation, despite the mistakes made thus far. Additionally, the resources being used to sustain Jahai's body are futile. She will not be brought back to life by these resources. Given the severity of her condition, there was absolutely no chance that she would be able to come off the ventilator. The hospital has a duty to other patients as well, and they need to redistribute those resources. California state law actually indicates that hospitals must give the family 1 week for a mourning period, but after that, the hospitals need to redistribute resources to other patients in urgent need of care. Additionally, the family is not in a capacity to make the decision to continue the use of mechanical ventilation. A systemic review of surrogate decision makers actually found that only 68% of surrogates predicted patients' treatment preferences. The likelihood that Jahai's family makes the perfectly ethical and fair decision is low, even without the consideration of the extenuating circumstances they have been placed in. Also, clearly making life or death decisions while processing a massive amount of grief is not only difficult but nearly impossible. These desperate situations often leave families looking for a miracle or something of the like, especially in the age of social media when we always see really beautiful cases of survival on our news feeds, or like clickbait articles and things like that, just news entities trying to get likes and reads on their pages. But in the end, this just sets really unrealistic expectations for healthcare teams and sets unrealistic expectations in the minds of family. Okay, sorry, next slide. In a case like Jahai's, mistakes in the judgment of surrogate decision makers might not only result from the misleading interpretation of body warmth and other functions as quote-unquote alive, but also to the confusing and vague language surrounding the definition of death used in clinical practice. When Jahai's family observes expanding lungs, a warm body, and a beating heart, what entity are they more willing to trust? Their own instincts and biases, or the hospital and healthcare providers that just unexpectedly took their daughter away from them? If the McMaths feel as if they are removing life-sustaining care from their very alive daughter, the fear and guilt that surround the removal of that care would overwhelm the decision-making capacity. So if instead of knowing that this mechanical ventilation, removing it would be removing it from their daughter's dead body, they feel as if they're removing it from their daughter's very alive body, they're gonna bear that guilt. So that's a very overwhelming feeling for them. So that kind of plays a really big role in their decision-making capacity and definitely what decision they might make. They're going to err on the side of caution and life, of course, there. I think as we all might. Not only should the McMaths not be able to make this decision, they should never have been faced with it in the first place.
Counter-argument consideration. Our first anticipated counter-argument is that death exists on a continuum. In this situation, the binary definitions of death and life exist on opposite ends of this continuum, and everywhere in between is a small little gray area of different varying levels of death and life. For Jahi, her body still has many organs that are viable and functioning, allowing her to fall on a place that is not all the way on the far left extreme of being dead. Jahi would then be considered still alive because of these functioning organs. And therefore, if we remove the ventilator, which is part of the reason why she is more alive than dead, then that would be killing her, and that's why the ventilator should not be removed. But our response is, where would Jahi fall on this line, though, when you compare where she was before and after the surgery. Before the surgery, Jahi was able to interact with others, she was conscious, she went to school, she did many of the things that a normal living person would do. And after the surgery, she is not conscious, she cannot interact with others, she requires medical intervention for her body to even be considered alive. So, we predict that the gap between her state before and after the surgery was her process of death. It wasn't just a random event that happened. So during this process, that was like when Jahi went through her cardiac arrest, and that was where the oxygenation to her brain was lost, causing her brain to die and causing her respiratory control center in the brain to then fail. A second potential counterargument is that brain death is not a valid diagnosis for any person that is dead. The current agreed upon definition of brain death today is based on this whole brain death idea. So in this situation, all parts of the brain are dead. The cortex, the cerebellum, the brainstem, so no parts of the brain can contribute to life-sustaining functions like breathing or temperature regulation. And then there's the higher brain death definition that is more based on this loss of consciousness and cognitive ability. But the higher brain definition of death is not as valid of a definition for death because there are people, in the world that have lower cognitive ability or consciousness, and they're not considered dead. So it's more controversial, and that's more of it's sticky in like a moral situation. So that is not up for like a doctor to decide, or it's not just, you can't approach it from just a medical standpoint. So with this argument, Dr. Schumann is cited in As Good as Dead, Is There Really Such a Thing as Brain Death? He's cited fighting against this idea that brain death is a valid diagnosis because brain death, or whole brain death, is essentially a spin-off of higher brain death in the modern world because a ventilator and other medical interventions are allowed to keep the body alive. So the only thing that is really lost from the body is consciousness or cognitive abilities. And that serves for Jahi's case as well. Her heart can still beat, and the ventilator is allowing her lungs to function properly. So she's not actually dead, or she could only be considered higher or dead on the higher brain death standpoint, rather than just the whole brain death standpoint, since the ventilator is allowing her lungs to function. And in this case, removing the ventilator would be what kills her, rather than noting that cardiac arrest was what killed her. But our response is that we should look at this situation from multiple standpoints instead then. So thinking about what Epicurus said about death, he said that when you're dead, you've lost all ability for human experience, and you are no longer able to interact with others as a human being or do any of the normal daily tasks as any living person. And that's the case for Jahi. She's only able to breathe due to a ventilator, and she's never going to be able to wake up from her situation. And so by the philosophical standpoint, she would be considered dead. And still looking at the medical approach, we can use the concept of the integrated whole, though it was formed from the basis of the whole brain death definition. So with the integrated whole, it basically states that your body, all of your all of your organs function together as an integrated whole that receive stimuli and respond to stimuli based on each other to function properly and in the best way possible. So any loss of any one or two organs would result in the eventual loss of other organs because they all depend on each other. And in Jahi's case, this is true with her brain and her lungs. Her brain has died and no longer functions, and her lungs are paying the price and no longer function and require a ventilator to do so. But also, the death of her brain in general, even if it's not considered the only, or like the end-all be-all, it's one of many organs that has failed, and by this situation, she's still considered dead because of multiple organs failing and the loss of the integrated whole. Even the interventions of a ventilator will not allow her body to not allow her body to
In closing, Jahi McMath should be removed from the ventilator because she is dead. Jahi suffered from full brain death, so there is no chance that she will ever regain integrated functions. The severity of her case made the use of medical resources futile, and they should have been redistributed throughout the hospital to more urgent cases. The suddenness and emotionality of the case clouded the family's judgment, so they should not have had decision-making capacity. The ethical ending to this case should be to follow the hospital's decisions and remove the ventilator.